give
This
it.
conference will now be recorded.
We're going to go ahead and get started so we can make sure that we answer any questions. So Joe Felice, welcome.
I appreciate it.
You are with the Avalon Insurance Services, and you've been a great partner with the East Orlando Chamber as one of our trustees, as well as a partner with our health benefits program. And so I'm going to turn the program over to you. Tell us a little bit more about insurance, and then, you know, the importance of telemedicine, especially right now as we're going through the COVID-19 issues.
Sure. Well, thank you, Dorothy. I appreciate it. Yeah, I'll just give a real quick brief background about myself. I'm Joe Felice. I'm owner and president of Avalon Insurance Services. What we are is we're an employee benefits brokerage. Two important key concepts there: employee benefits brokerage. We deal specifically with employee benefits. So dealing with your health, your life, disability, dental, telemedicine, critical illness, accident. We focus on that, solely focus on that. We don't do cars, boats, houses, or anything like that. The second concept there is a brokerage. What it means is we are licensed, contracted with all major carriers in the market. So what we do is we customize a benefit plan made for the needs of the group or the individual. As Dorothy said, which I'm very proud of, is we've been members of the EOCC for, all these gray hairs are showing it, but I want to say almost 5 years now. We just entered into our third year as a trustee. We are very proud of that. We're very proud of the East Orlando Chamber of Commerce and what they've done for us and our community and strong supporters. With that said, about 3.5, 4 years ago, maybe 3.5 years ago, we started discussions with Dorothy about how we can partner with the chamber and enhance their membership by providing healthcare coverages to the companies and to the members of those companies of the chamber. And we came up a few years ago with one of the first in the state. The Orlando Medical News put a nice article out on myself and the EOC and what we were able to do by doing something first in the state, and that's introducing a group telemedicine plan through your membership. So what that means is the insurance company looked at the East Orlando Chamber of Commerce as one huge, large company and all its members as its employees. So they were granted by permission through the state of Florida to have a group insurance plan. So that entails the members of the chamber to get on this plan at a group plan. I'll go into that detail later, but basically in layman's terms, it means more benefits at a much more competitive rate. We can jump into it here. What are we doing today? Dorothy and I and Andrew, we're going to talk briefly about the telemedicine, what it is, what's the importance of it today very briefly, and then go into your plan offer through your membership with the EOCC. Topics of discussion are going to be brief. We have 3 of them. The first is what is telemedicine. We're just going to briefly discuss what it is so we're all on the same page here. There's nothing tricky, but make sure we're all talking about the same thing. The second thing is the importance of telemedicine today. You know, not more directly in the world, that's very important, but to you, the consumer, you, your employees, and you, your family, what's the importance of it to you? And then the third thing is our EOCC membership and how it has a telemedicine healthcare plan embedded into it and available to you. So let's get into it. The first thing, doesn't matter what side of the fence you sit on, if you're a CNN guy, Fox News girl, MSNBC person, local news person, Democrat, Republican, doesn't really matter. If you've been watching the news, you've undoubtedly heard these terms over and over and over again the last few weeks: telemedicine, telehealth, virtual care, virtual medicine, e-health, and many more. For all practical purposes of this discussion this morning, all these terms relatively mean the same thing. You're going to get some journalists, you're going to get some healthcare individuals, you're going to get some insurance carriers arguing that there's a difference between telemedicine and telehealth, where telemedicine is the actual practice of it and where telehealth encompasses a little more. But according to the dictionary today, telehealth is actually not in the dictionary, whether that be the Merriam-Webster dictionary or the Cambridge dictionary. Telemedicine is in the dictionary, and it's been in there since 1968. The definition is pretty simple. It's the practice of medicine when the doctor and the patient are widely separated using two-way voice and visual communication. So in all practical and layman's terms, it means a doctor seeing, treating, diagnosing, prescribing to a patient, not in physical face-to-face contact. So any type of medicine being practiced where the two individuals are not side by side with contact. As you can see, it first kind of came up in 1968 with the term. It's been around for a long time. It was introduced in the military. If you think about it, somebody gets hurt on the battlefield or war, they don't always have doctors around, so they're telecommunicating on the sergeant, the doctor at hand, what to do, symptoms, you know, how that goes. So as it got brought, our technology developed through the 70s, 80s, 90s, and it really blew up at the turn of the century. That's when it started getting more to the consumer and the civilian life. As of 2000, these terms and these products started popping up. By 2010, you had about 10 companies doing this. And today you actually have around 10 to 12 companies still doing it. That is just totally exploding. But there is one company out there that's a public company. And the only reason why I bring this up is it's on the stock market. It's called Teladoc. It's one of the only ones that are public. The stock for Teladoc 1 year ago today was $52 or $3. Today it's almost $200. So you can see the importance, the popularity, not only from a consumer perspective, but also an investor perspective, and how this is getting into what we're doing today. What's the importance of telemedicine to the consumer today? Well, you see a lot of going on. We understand we're in a global pandemic right now. If you wanted to go see your doctor because you have a sore throat, I wish you luck, because you're going to have a very hard time getting in there. And not only that, are you going to have a hard time getting in there because most of our doctors right now are obviously being overworked, overwhelmed because of the circumstances. If there is a doctor out there that's practiced can see you for a sore throat or an earache, 99% of the time they're going to force you to telemedicine right now. And what's the reason for that? It's safety. It's our social distancing rule. We can't have a waiting room filled with people passing everything around and passing it to the doctor who's going to then pass it to the next patient. So whether you have a telemedicine plan or not, whether you have insurance or not, currently most doctors are forcing you to use the telemedicine route. I was talking to Dorothy earlier and I said, you know, what's important about that? Well, think about it. If you have health insurance, you have Blue Cross, United Healthcare, Oscar, Cigna, Aetna, whatever it may be, you have an insurance plan. And you call your doctor traditionally because you have an earache or a sore throat. Your doctor says, under these conditions, we're not seeing patients right now. We're going to see you very teleconference, virtual care, however you want to refer to it as. So call this number or call us up and we'll do our consult there. Well, the employee, the patient, whoever we're talking about does that because they're listening to their doctor and taking their advice. They call them up, they had the consult, everything went great. They were seen, yes, you have an earache, an inner swimmer's ear. I'm going to give you some antibiotic ear drops and an oral antibiotic for the inner ear infection. Thank you, hang up, done. Go to Publix, pick up my prescription, we're good. I get a bill 3 weeks later, which is starting to happen now, and the bill says $289. Well, wait a minute, I have insurance. Yes, you have insurance, but your telemedicine visit wasn't covered under your insurance plan. So now it's seen as an out-of-network, non-covered visit where you have to pay the whole thing for it. Sometimes your major medical plan will have telehealth involved in it. And at that time, when there is telehealth, it's usually counted as a typical doctor visit. So you're going to pay whatever your copay may be, or maybe a different special copay, and then whatever charges for the scene visit with the doctor. So there are different methods where you have to understand your insurance like any time. But currently right now, if you look around on the news and you look around on the internet, there's a lot of people complaining with their insurance companies because they're being forced to use telemedicine from their doctor and their insurance companies aren't covering it. So long-winded story, just kind of what's happening today and why we're getting relevant of it in our use today. Three main reasons the consumer should be aware of this is one, and it's funny because this top one here was always on the bottom until about a month ago, and then it got boosted up to the top. The obvious reasons, consumer safety advantage, okay? We'll get into that in a second. The second is consumer financial advantage. The money you're saving is a fraction of what you'd be paying for medical insurance. And your third one is the consumer time and convenience advantage. So like I said, this first one, consumer safety advantage, has always been on the bottom when I do this presentation. A month ago, got bumped to the top, and we'll talk about why. Consumer safety advantage. When you go to the doctor, whether it's taking yourself, your daughter, your parents now that need assistance, whoever it may be, whether it's the clinic, sore throat, Orlando Health, Florida Advent, urgent care, emergency care, they typically look something like this. Maybe not the Chick-fil-A bag, that looks a pretty fun one, right? Or this. They're not welcoming areas, right? There's not a lot of happy people in there looking like they're ready to go out and skip. Most people have ailments or issues. That's why they're at the doctor in the first place. Now, this was the norm going into it a month ago when you went to a doctor. This is what everybody would typically look to see, to sit down, wait for your number to be called, maybe 15, 20, 30 minutes. If you're lucky, go back and you're good. How's it changed? Obviously, there's a lot of reasons out there this has changed. These are the most, okay, this isn't happening right now. This is not the norm anymore. This isn't even allowed, right? These waiting rooms right now are empty and you're being forced to the telemedicine. When this is all said and done, we might see a new norm what these look like, but this concern has always been there. Why do you want to go to the doctor's office when you have an earache, when you have a sore throat, when you have a rash, when you have a urinary tract infection, when you have over 70% of things doctors can handle via telemedicine? Why do you want to take yourself, your spouse, your parent, or your child and incubate them in a room with a bunch of sick people? It's one of our concerns. It's one of the most talked about things today. So that's driving one of the consumer advantages here. For the second thing, another advantage, huge advantage, is the financial savings, okay? Whether you have health insurance or not, these plans coexist. If you don't have health insurance, this is an even more huge advantage to you, but if you do have health insurance, this is a way to save money. Reason why, how much does health insurance cost a month? Well, it depends on the person, depends on if you're getting it through your company, on your own, what kind of health you're in, what age you are, but undoubtedly, individual health plan is going to cost you hundreds of dollars a month, correct? How many hundreds that is ranges from $300 to $850 depending on your situation. A family medical plan for you and your family is going to cost you thousands of dollars a month, $1,000 to $2,500 a month for a major medical plan, correct? And these are the rates we've been seeing, and they go up every single year, and unfortunately that's been a trend for the last 10 years. Telemedicine is a fraction of the major medical coverage. 99.9% of the people on this planet can afford telemedicine coverage. That's why it was designed. That's why it's out there. It was designed 10 years ago as a crutch to a problem in our health industry where the rates are getting out of control. It was developed to say, how can we get more people in front of doctors at a lower rate to prevent some of the more expensive stuff that comes along, which inhibits all the costs. So obviously you're looking at, and we'll get into prices a little later, but you're looking from 2 to 5% of your major medical coverage is what it costs a month. Third driving convenience, the third driving advantage is convenience and time for the consumer. Okay, obviously goes without saying, we all have a lot on our plates, or we did up to a month ago. We tend to have a lot of time right now, so somebody probably wouldn't mind going to the doctor, but obviously that's not an option. So average wait for telemedicine to see a doctor is approximately 15 to 20 minutes, and that's 24 hours a day, 7 days a week, 365 days a year. Again, I have an earache, I have strep throat, my son's got strep throat, you know, whatever your ailments may be, the normal process is call the doctor, talk to the receptionist is going to schedule an appointment for you. If it's a child, they may be able to get you in today. If it's an emergency where you're not really feeling, maybe you'll squeeze in today, maybe tomorrow. But any type of appointments can take hours, can take days, or even weeks to see a specialist. Whenever you call your telemedicine, whatever you input your ailment, they are going to get you a specialist for that treatment. If you're calling for a UTI, they're going to get you a doctor that specializes in that type of treatment, which is going to be different from a dermatologist where I have this uncontrollable rash and it broke out and it's just everywhere this morning when I woke up. It's going to be a completely separate doctor. So they're going to be board specified in what your ailment is. So again, traditional doctor appointments take hours, days, or even weeks. Huge time and convenience factor. Convenience, you don't have to schedule the appointment. You don't have to take time off work. You don't have to take time off school picking your children up and work, taking them to the doctor's appointment, which may be 20 minutes downtown Orlando, waiting in the appointment booking room with all the other sick people like we showed for 20, 30 minutes, going in and seeing them, driving across town to get the prescription, coming home. With the telemedicine, you can see the doctor from your couch, from your office, from your hotel room when you're on work, 15, 20 minutes, see the doctor, be diagnosed, if necessary, prescribe a prescription, and they're going to call it into your local pharmacy that you choose, which is probably the Publix on your closest corner or Walgreens. This can all be done in a matter of 30 to 45 minutes from time of calling, setting up the appointment, being seen, diagnosed, and going to pick up your prescription from Publix. So it's a huge time and convenience advantage. Now I'm going to dive right into the program a little more in depth and what the EOC is offering. Through your membership with the EOC, all employees, all member employees, all members and the employees of the members are eligible for the telemedicine program. What does this encompass? We kind of went over it briefly. It's with MD Live. MD Live is one of the leading providers in the industry. They're actually based here in Southern Florida. The plan covers 70% of all doctor visits on average and over 40% of all urgent care and emergency room visits. Okay, that's the strong thing that I want everybody to understand. Covers 70% of all doctor visits and over 40% of all urgent care and ER visits. If you look down here at the second bulletin, $14 a month. And we went over medical insurance premiums a little earlier. Now I'm going to get you the exact price. For the MD Live program through the chamber, it's $14 a month for you and all your dependents in your household. And that varies greatly, and it's very important to understand this. If you have major medical insurance and your major medical, those are two ands, and your major medical insurance encompasses a telehealth, okay? Your telehealth is going to charge you, like your doctor, co-pays and deductibles. But more importantly, that telehealth only covers whoever took the medical insurance. So if I'm working at a company and I took employee-only medical and the telehealth is in the medical additional charge, it's only covering me. I would have to take spouse coverage to cover myself and my spouse. I'd have to take family coverage for it to cover the whole family. Now, with taking the family coverage, as we went over earlier, paying $1,000, $1,500, $2,500 for the family coverage medical. The MD Live program we set up through the chamber is $14 a month for you and all your dependents. So that means anybody living in your house, whether it be spouse, children, adopted children, or parents in your household. Even your traditional medical plan, there's no traditional medical plan out there that encompasses all household dependents, including parents. So think about that, $14 a month if you have a large family or you have parents living with you or godchildren, whatever it may be, all dependents in your house. Unlimited usage of doctor visits. I can call 3 times a day. My wife can call 3 times a day. I can call twice on my son and once on my dad. Unlimited, and I'm never going to pay another dollar out of pocket. There are no co-pays and there are no deductibles for anybody on the plan. Now, the importance of this is quite simple. It allows you, I'm going to go back to the top, it allows you 24/7, 365 access to virtual care board certified doctor. You do not have to wait. You do not have to pay exorbitant amounts of money. You don't have to have times of concern and stress and worry. The time you're going to the emergency room because you don't know if you should or shouldn't, but it's 12:30 at night and you're a little scared, so you're just going to play it safe and show up and go anyways. That could save you hundreds, if not thousands of dollars by consulting with MD Live and saying, hey, this is the situation. This is what's going on. I'm a little hesitant or anxious or scared, and I'm thinking I might need to go to the emergency room. They're going to talk to you and say, yes, absolutely, go to the emergency room. It's needed right now. We're calling an ambulance. It's on the way. Or they're going to say, you know, after looking at you, diagnosing you, I think you are being a little stressed and anxious. There's no need to go to the emergency room. Let's watch this for 24 hours. Call a consult back tomorrow. If you feel uncomfortable, call a doctor tomorrow. So it's the urgency. How many times have you woke up with the children and hit the end of the rope and you know they have an ear infection or you know they had the strep throat and you just waited and they woke up and all of a sudden the doctor's closed, so we're running to the urgent care. And we're running to the urgent care for the need of really getting a prescription because you know it's ear infection. He's crying and it's ear pulling on the earlobe and you know what it is, but you have to get the prescription. Doctor's offices are closed. What's your only option? Urgent care, if it's available around you, and if not, emergency room. Now I'm going to go into this. I don't know if you can see this specifically. This is the flyer that the chamber has and I have, and we can send this to you at any time. You've probably seen this around at our events. It goes into more specifically about the actual plan the chamber's offering. When you look at it, there's 3 aspects of things that can be treated. You're having your typical medical issues, you're having your dermatology issues, and you're also focusing on mental behavioral issues. So this encompasses a whole lot here. When you're coming to your standard medical issues, you're looking at acne, allergies, asthma, bronchitis, cold and flu, constipation, diarrhea, ear infection, fever, headache, insect bites, joint aches, nausea, rashes, sinus infection, sore throat, UTI, and now COVID ID identification, right? What does that mean? The doctors today are asking you to be seen by a telehealth provider so that they can give you the okay to go get your official test. You have to be seen by somebody to go get an official test. Somebody has to verify, a doctor, that yes, you do have the symptoms that are necessary to be tested by the COVID-19. They're going to be sending you to telemedicine. If you don't have a telemedicine plan, you're going to have to call up on your doctor. You're going to have to go through the doctor, which is going to be an exorbitant charge. With this plan, as of right now, one of the great things is anybody can call up at any time that they're feeling symptomatic, and they're going to diagnose you right there and say, yes, you should probably go get the test. Here's the form to go get it, the official form. Or they're going to say, no, you're fine. I think it's a cold flu. Here's a Z-Pack or that. So huge right now in that aspect. Also in the dermatology aspect, whether it's rashes, acne, and anything going on with the skin. And then the most prevalent one in recent times in the last year has been the mental health. They're doing everything from stress, anxiety, depression, and treating issues too. They have psychiatrists available, psychotherapy available. So there's a lot of interesting things going on, and they're trying to be out there, and they're trying to really bring that 70% up. But the reality of it is it's always going to be around 70 or 75% of what they can cover because they're non-emergencies. That's what everybody's got to understand. If you're in a car accident and you broke your arm, or you're in a car accident and you broke your leg, telemedicine is not going to do anything for you. You're going to have to go to emergency room and get that taken care of. So there are some limits, and it's not meant to replace full medical insurance for the hospitalization purpose. Now, when it comes down to here, I'm going to read this bottom section. This is very important too. We kind of briefly went over it. Who are the doctors? MD Live prides themselves on having doctors with at least 15 years of experience in their discipline. So if you're calling a dermatologist, you're going to get, and you're in the state of Florida, you're going to get a Florida State Board Certified Doctor Dermatologist. Minnesota calling, you're going to get a Minnesota State Board Certified Doctor Dermatologist. A couple reasons why that's important. So you can get around state laws. When it comes times to prescribing prescriptions, the doctor has to be able to be state certified to prescribe you those prescriptions. So pride themselves on 15 years of doctor, not getting anybody outside of their prescription. How much does it cost? We already went over this. It's $14 a month for the plan for you and your individuals. And we have a the chamber. There's never any additional cost for the copay or prescriptions. Excuse me, for copays or deductibles. Anybody can call up MD Live and get an individual plan with them. And how that works is they're going to give you a code. They're going to set you up on their app. And really all that means is now you're in the system. You can call us when you need us, and you're going to pay through that. However, when you call and pay, you're going to pay $180 for this service, $189 for this service, $75 from this visit, $50 in this visit. It's not a group plan. A group plan means you're in and you're paying one flat monthly premium, and you have unlimited visits and care for you and everybody in your household with no additional cost. If you guys have any questions, you can take down my contact information here. You can text me, you can call the office, you can stop by and visit us, you shoot me an email, or you can contact the EOC directly. I want to show you one thing. I'm going to see if this is going to work, Dorothy. I wanted to show that video if I can get it up there, so bear with me, I'm sorry. Sorry, guys. There's a little video gives you a little better idea from describing.
Is that muted, your video, Joe?
Is it muted?
Yeah, I'm just asking because you really can't hear it.
All right, I can send that out too. I think you guys have the 2 links for those, but those are basically the commercials that are being shown right now for MD Live. And it kind of just gives you a more example of how the product's used and then the ways to go about it. I can't stress enough right now. I don't know what everybody's situation is. If you're independent, if you're an employee, if you're part of a company, you own a company, you're part of that management. But right now in the business world, we're in unprecedented times. A lot of these companies are asking people to still work. And that's asking a whole lot of somebody, especially when I go into Publix and when I go into the gas station or we pick up food. These people are at a lot of risk, and the companies are asking a whole heck of a lot from their employees that are still showing up on a daily basis, especially interacting with the public. What you've seen in today's world is going to change and reshape everything. If you think about it, with the number of deaths we've had in the United States alone, in the next year or so, you're going to see that affect our life insurance rates undoubtedly through your group plans and through your individual plans. Everybody's complained about our medical insurance going up. It's been going up for forever, but in the last 10, 12 years, it's been skyrocketing at rates that no one's seen before. Unfortunately, with this pandemic going on right now, if we stop and think about it, there's over 1 million diagnosed cases, 1,300,000. How many of those are in America? These are all going on our medical insurance plans. These are all going on claims experience. Insurance rates are not that tricky. How much money's coming in? How much money's coming out? When more money is going out for claims that the insurance company is paying for claims, that means the rates go up because they're losing money. They're not a nonprofit organization. They have a target percentage that they need to be profitable to keep the wheels running. So when they pay out more in claims than they do bring in for monthly premium, that's why you see your rate go up at the end of the year. Well, let's think about this from a fundamental perspective. What's going on in the world today? Our hospitals are extremely overwhelmed, and I'm not going to beat a dead horse. Okay, for God's sake, we're building hospitals in parks right now. We're asking doctors to come from other states and even other countries to come help us out. All that translates into, and just being a realist and talking about the dollar signs of it, all that translates into is extremely high healthcare costs. The claims are going to be exorbitant from what's going on. So my long-winded story in saying this is, I would not expect any rate relief from your monthly premiums for your major medical plans. You're not going to see cheaper rates next year. You're not going to see a sale when you come to renew your medical program where it's 25% off. Unfortunately, you're probably going to see the difference. If companies are going to stay in business providing health insurance, they can't take a beating like this. So I don't want to scare anybody. That's not the point. But the point is we got to think of what's coming and how we can best arm ourselves. And a lot of times our employees, the people we're asking to go out and do stuff for us, the people we're asking to show up at the Pizza Hut every day, the people we're asking to show up to keep the wheels running, to keep the lights on, the people that are showing up at Publix, the employees, what are you giving them as an employer? That's another topic of discussion. These are tough times. People are being furloughed. People are being let go. The dollars are tight for a company. It's understandable if you cannot afford as a company a $500 monthly premium for an employee medical insurance. A lot of times it's, well, if I do that, I can't afford the employee. That's understandable. But who can't afford $14 a month for their employee when you're asking them to do things in these unprecedented times where they're putting themselves at risk? And at $14 a month, you're not only protecting them, you're protecting their whole family. And you're giving them options in these times where the major medical insurance isn't providing them, nor the general public. So more than ever, we rode this wave with the EOC and saw this 4 or 5 years ago when we designed this program, because we saw the importance of it. We saw how people can seek doctor care, real virtual doctor care, being seen, being diagnosed, and being prescribed at an affordable rate before this happened. Now that this has happened, this is even more important to you, to your company, and to your employees, to give them the option, to give them the opportunity, to give them the access to see a doctor, instead of saying, here, you got to wait in line. And by the way, when you are finally seen, don't be surprised about that bill. We can't help you out with anything there. You can help them out by paying the $14 a month. And if you can't do the $14 a month, which I've been stressing to every company, especially in our book of business, you have to give them the ability to make that choice for them. So if you don't want to cover it, you can't cover it, God bless, I understand these are tough times. Give them the option to say, yes, I want it for my family. I'm willing to pay the $14 a month. I get paid twice a month. That's $7 coming out of my paycheck. And I can see the doctor whenever I want, and my family can see the doctor whenever I want. So I applaud the EOC for doing this. We've been doing this now maybe a year or two, and we've had this program. It works well. It's extremely popular. I have probably over 1,500 people throughout the country enrolled on this program. Most of my book of business has this involved in it. So most of my book of business, and by that I mean the companies that I insure, have a major medical plan, and they also have a telemedicine plan. And for those companies that don't have a major medical plan, then they do have the telemedicine plan in loop of it. I'm a big fan of this. I've been a proponent for many years, and I think you're going to see the explosion of the market and the telemedicine market in the next 6 months to 12 months. And you're going to see actually more capabilities, not just from the company we have, but from the industry as a whole. So this is something, again, Andrew and Dorothy, you guys should be proud of. This is strong membership advantage here. And it's really just getting it out and getting a new concept out, getting people to understand it, and getting people to understand how to use it. So long-winded stories, telehealth for you guys. Does anybody have any questions, or can I answer any?
I have a question. First of all, thank you for all the information. It was very interesting to listen to you. I just give you quick information about me. I work in the medical insurance finances, mostly for international patients, for 20+ years. So I absolutely got everything you say, and I agree with you very much that telemedicine is right now what's gonna go all the way to the roof. And one of the industries that you're gonna have a lot of jobs, it's gonna be anything related to medical field, anything. So, but there is one thing which I am out a little bit of everything what's going on in US for the last 4 years. And I remember there was always problem with the HIPAA law when it comes to anything related to telemedicine. First of all, about the HIPAA law. So that was my first question, how that was really solved. Maybe we can even talk about it later. But another thing is, you say that besides that, the plan that you have, that $14 a month, that doesn't have included anything related to the coverage when someone is admitted to hospital. For that is a major plan, right?
Correct. Yes. That's where they say it covers approximately 70% of all doctor visits, because the other 30% would
70-30, yeah.
Would require hospitalization, and that's exactly correct. That's the other 30% that requires anything hospitalization or plans after that. And then the 40% urgent care and emergency room visits, the other 60% because it requires hospitalization or a surgery or stitches or something like that from that urgent care or emergency room visit.
So that goes to the rest goes to the major plan, to the regular plan, regular insurance.
Correct.
Okay, so you are the first, first payer, and they are secondary, and then there could be third one, whatever. But you're the bill goes to you, and the balance goes to the main insurance, right?
Actually, you have no bill, because through the EOC plan,
direct with them.
No copay, no deductibles, unlimited services for all services they provide. Anything they can do, they're going to do it. You can call them 10 times a day. You're never going to receive a bill or a payment or request. Now, if something is serious and you have to go to the hospital, they're going to refer you to go somewhere, and then you would get the bill from that hospital that you were seen at. But Mendy Live will never give you a bill.
So where you really save money, besides everything you mentioned, which was the time, safety, now the most important, etc., is the money you're saving. If you have your major insurance and you will have to do all those visits, ER, whatever it is, it will cost you much more with deductibles and co-pays.
Absolutely.
Sometimes then what you saving now, paying that $14 a month, where you don't pay for those extras. Really,
absolutely.
That's how the people should look at it.
Absolutely.
That's where the main saving is. And of course, the first selling point right now for this kind of service, it's a safety, of course.
You understand, you're absolutely right. If you think of it this way, the reason why it works well with major medical or without it, for example, I have a HSA, high deductible medical plan. Thank God, been sick a lot.
Yep.
So I took that option with the
I
$5,000.
hear you.
So now with that said though, I got to pay the first $5,000. So when I go to my doctor for my earache or my strep throat, I'm paying for it, whatever the costs are, I'm paying out of my pocket. So I'm paying like $200 to go see the doctor until I hit my deductible. Well, telemedicine, I don't do that. I just call up the telemedicine and it's free. So I'm saving the $200 or $150, $250 every single time because I'm not wiping through my deductible. Personally, I'm only going to go if I need something big done or I can't be done at telemedicine. Same thing applies to somebody that does not have insurance. If you do not have insurance, you got to go to the doctor or the clinic or the urgent care. You're paying out of your pocket 100%. Whereas if you have the telemedicine, you're just paying your $14 a month for you and the family. You'll never have to pay a thing. So to go get your earache, your sinus infection, your urinary tract infection, whatever it may be at the doctor, and it's costing you whatever to go see them, now you can have that coverage for the $14 a month and never pay.
So you have a special rate set with the medical providers the same way like the insurance company, like major insurance companies. Okay, so when everything is billed at the end, so it's not billed as a insurance, the major insurance, it's not billed as a self-pay, it's billed as.
It's billed to MD Live. So they're taking care of the whole bill. So you will never see a bill being a patient from MD Live. You'll never see a bill.
But you're gonna just see the balance, right? If there is any. Like if you go to there is 70-30.
No, there's no balance. You'll never pay a thing for any service you receive from MD Live. You'll never pay a penny out of pocket. Now, if they suggest you have something really serious going on and say, no, this is an emergency, the hospital right away, then when you go to the hospital, anything gets done at the hospital, they'll give you a bill. But any service you're through MD Live where you hang up and it's resolved, you'll never receive a bill from them.
When I go to hospital and I get that bill that you mentioned, how I am billed as a self-pay or I am billed as someone who that insurance doesn't cover that balance kind of. You follow me because those are two different things and two different amounts that the people are charged.
It would be dependent upon you and your major medical coverage. If you have major medical coverage,
still that.
It would go under your major medical for emergency.
If I don't have, then I am still charged for that as a self-pay?
Yes, correct.
Interesting. Yeah. Okay.
So to chime in, just to kind of like an example, if I go to Centric Care, which is an urgent care center, it costs me $50 as a copay to go see the doctor to tell him to say, okay, you have a fever, you have the flu, here's your antibiotic, here's your prescription to go to get your antibiotic. I paid $50, okay, to Centric Care. With the telemedicine, I pay $14 a month, okay? And so instead of paying $50 every time I'm sick as a copay, I have $14 and it covers everybody in the family, my daughter, my wife, the whole 9 yards. So everybody in the household can do it. Because right now, like if my daughter gets a cold or has something, I can go to a pediatrician, pay $35. Okay, she's got a cold. Oh, she's just got a cold. She needs some Flonase. She needs this and this, and go from there. Where a doctor could diagnose her over the phone or on a smartphone, tablet, virtually. So where the piece comes in and where we've used it is that I'm saving on all of my copays that I'm paying on my major medical. So that's where the discount comes in and where the telehealth. Plus, I'm getting seen. I don't have to worry about trying to take off work to now try to find time for taking my daughter in. I can do this. It's 24/7. I can get Andrea at 6:30 in the morning and say, look, we've got a fever going. We've got this, and this. What should we do? It can be a consult. They might say, just give her 2 Tylenols and let her go to rest it off and call back in 2 hours. They link the information, if I'm not mistaken, if you want it to your primary care, correct?
Correct.
So if you have a primary care physician, so our pediatrician, they can send a message over to them and say, hey, this is what we have encountered, and this is what we're doing currently for treatment. And then if she has a concern, she can call us personally and go from there. or from a piece there. But the nice part is it works all over. And if you have kids that are in other parts of the country, like let's say you have kids that are in college that are in Indiana and New York City, they can also take a part of the plan, and they're seeing a board certified doctor within that region that they live in. And so what it has done for us is that it allows us to be able to get in, see a doctor, not have to be in that waiting room, taking extra time when you're already feeling horrible. The other piece is like with this COVID-19, and they just had a big thing on the front page of the paper. I don't know if you guys got a chance to read it this morning, but they just opened up a brand new drive-through site for testing. If you don't have a doctor's note to go get tested, you're not going to get tested. Your insurance still has to cover the cost of that test. So it's not like I can go to the convention center, go get tested. I'm going to get a bill from whoever the testing agent or the lab, wherever they're doing it, if my insurance doesn't take it, or if I don't have insurance. But before I can even get in that line to get tested, I have to have a doctor's note or permission from a doctor saying that, yes, they feel that I have the symptoms to do so. Right now, doctors are not letting you in to their offices. Nobody is getting anywhere, so they're going to telehealth, especially with this. And I personally think that this is just a tip of an iceberg that we're going to have. This is going to become more and more as we are a close-knit world, that when something happens, it's going to be hit sooner rather than later. And so people are going to be diagnosed quicker. And this may happen again 2 to 3 years in the next winter somewhere else in the world. And all of a sudden, everybody's getting freaked out and worried about this pandemic potentially happening, that telehealth is going to become more and more of of a way of life. And I think, Joe, you mentioned this, but insurance companies, and my wife has it on her insurance plan, which is great. But if I go to use her telehealth, it's $20 copay for me to do it. It covers her, but it doesn't cover me. And so now with the plan that we have for $14 a month, it's a lot cheaper for me to have something like that than it is for utilizing my wife's. Because if I'm going to spend $20 on a copay to go see telehealth with her physician or through her insurance, I might as well just go ahead and wait and go to the doctor, pay $35, and then go from there. So the pricing that we've been able to negotiate with this and getting in early has really helped us as an organization to be able to offer this to employees and to employers at a very discounted rate. If you keep your eyes out there and look at things, or if you're pricing it out, you're going to pay a lot more per person. I think, Joe, I don't have any of those exact figures on me, but I have heard from people that offer it. And other insurance things are saying, wow, you have gotten a really good price on there, that it is beaten what their going rate is for them. So it is a great advantage at that price point. And we do encourage our members. It's a great benefit to be able to offer to employees, whether you as an employer take advantage of it or want to just say, hey, look, we have this for you as an employee, as a benefit for an employee. Because there are a lot of people that, when some of the restrictions have come off from the Affordable Care Act, people drop because there's no mandate for that, having that coverage, that people don't have anything. And here's something that at least I can see a doctor for $14 a month. I can have the opportunity to be able to see a doctor 24/7 and cover everybody in my family for about 60 to 70% of what I might be going to a doctor for.
Yeah, you hit it on the head, Andrea. I mean, everything you said is dead on, and this might not apply to us, but the huge thing about what's going on in the world today, you hit it. In order to get tested for COVID-19, you have to have the doctor's note that signed off on it that said you are verified as having the conditions to go get tested. And that's what this allows you to do too. So I know this might not apply to any of us, but if you're asking employees to come to work and putting themselves out in the public every single day, I strongly believe you should be giving them, if you're not going to be paying for it as an employee or an employer, then you should be giving them the opportunity to purchase for themselves. But, I don't want to be on that. You get it well. It's bringing more options to our consumers and to our members where, hey, this might work for you, this might not work for you, but our job is to bring you more options and increase the value of the membership. And I think we're doing a pretty good job of that.
Hey, Joseph. Can you hear me?
Yes.
Hey, and I'm only asking this for some clarity.
Yes.
When you brought the MD Live site into the conversation, I went and looked around, and I'm noticing something. And some of this is strictly velocity and volume. I understand.
Sure.
So it says that we're experiencing a little bit longer than normal wait times due to the COVID-19 pandemic. I completely understand that. But it also says MD Live doctors cannot currently order tests for COVID-19.
No.
I'm just trying to make sure I have clarity on what that means.
Yeah. So basically, what that means is they can give you the symptoms to say that you can have it done. They can't order it for you. They can verify that you are symptomatic to go get it done. So
in other words, they can't necessarily send out a lab prescription for you to go to a lab. They tell you're experiencing X, Y, and Z, and we're advising you to go to the emergency room or go to a particular place to get this checked.
Oh, they can advise you to do that, yes. They just can't send you to a specific lab for a specific time. They can say, you're symptomatic, you need it. And that's what kind of Andrew was saying to you earlier.
Okay.
A lot of people are getting in line and don't have that note that says, yes, you can get tested. So they can't order it, like go to Orlando Health at 2:30, whatever Orange Avenue, and this is your appointment. But they can show that determines if they're symptomatic or not.
Okay. A couple of more questions.
Yeah.
So I'm online with Dr. Jones, who happens to be in Tampa, Florida. Doesn't necessarily matter where, they're state of Florida certified. Are there any instruments available for vital signs testing? Are they asking for blood pressure, pulse, and all those types of things? Is any of that stuff coordinated with MD Live, or is this more of a consult than anything else?
No, they're not doing vital signs, so that does limit that. So if it's an emergency where your vital signs are in question, they're going to send you to the emergency room. But no, it's a consult. They're diagnosing you, they're seeing you, and they're prescribing you your narcotics or drugs based upon your visit. So it's virtual care, so they're not actually able to take your blood pressure. They might ask you to do your temperature. That's pretty universal, but no, there's not the vital sign markings. If your vital signs are in question, then they're going to suggest you go to the emergency room.
And the reason I was asking that is I was curious to know, were there any medical devices that were integrated with MD Live?
No, not to the best of my knowledge, because it's for the general public. So you'd be assuming that the general public had these devices, which most have.
Now,
Okay.
Alonzo, I will look real quick. My husband had the flu, and so I actually called MD Live, and I had taken his temperature, so I was able to give her that particular vital. And also, strangely enough, she had him hold his phone up to his mouth and do and so she did diagnose him with the flu, called in it was Tamiflu to the pharmacy that we had. So from that perspective, that was how they, judge what we were doing, as well as asking for some symptoms. But yeah, I mean, it was very helpful, especially since it was like 8:30 or 9 o'clock at night.
I think anything visual that they can check.
Yeah, those are great questions. One of the things to understand is that this is not a replacement for your standard insurance. What this does is just give you another option that you can help combat healthcare with, you personally, your healthcare needs, and you combat it at a fraction of the price, and you can cover much more.
A couple of additional questions.
Yeah.
So this service is made available to EOCC members and their employees of their company?
Correct.
And everyone. So if I've got Joanne who's working for me and she's got a husband and 2 kids, they're all covered under the same $14 a month.
Correct.
That my company pays to EOCC. Or how does that work?
How does this work? Okay, let me explain this to you. If your company sponsors it, which company sponsored means your company's sponsoring. They don't have to pay for it. They can't pay for it. They don't have to. But sponsoring it means they're paying the check every month. Okay. We have groups in the EOC right now that I'll name a couple. Obviously, you guys, the Chamber's office, Dave from Engineering. There's a handful of them. So just like any of the other employee benefits, they get the bill every month and they pay the bill. Now, if they're paying for it for their employees, nothing else is required. They're just paying the $14 a month for the employees. If they're making their employees pay for it or a portion of it, then they just payroll deduct that portion from their paycheck. So if the employee is paying for it 100% themselves and they get paid twice a month, they're pulling $7 out every paycheck, and then the company's paying the check every month. So it's just like any other medical benefit, employee benefit. Now, if the product is not company sponsored, so basically they're saying my company doesn't sponsor this, you can go get it on your own, I don't care, but we don't want anything to do with it. Well, the individual still can do that. It's just going to cost them $5 more a month, and that $5 more is the payroll processing, because they don't have a payroll now. They're not through an employer. So it has to be processed. When it's going through the employer, MD Live agreed to pick up that $5 fee because they did a group plan which encompassed so many people. So they say, you know what, we'll waive that fee because you have a group plan. When they do it individually, with the price being so low, they can't do that. So that's why it's $19. But that's allowing any individual in the EOC that's not sponsored through their company to get that as well. So if you have your employee, let's just say, and I don't know your situation, but you have an employee you want to think about getting it for, you just pay the bill and you pull, if you're going to pay for it, you pay for it by them, fine. If you're not going to pay for it and they want to payroll deduct it, all right, I'm sorry, if you don't want to support it and just let it get them on their own, well, they can get it and they'll do their own payroll deduction basically. So
and then I'll do a quick calculation so I make sure I understand, okay?
Yeah.
So I've got a wife and 2 kids. So if I was to do this, is that 14 times 4 or is that 14 times 1 family?
14 one family. So it doesn't matter if you're by yourself, if you and a spouse, or you had the Brady Bunch, it's $14 for everybody.
Okay, and then let's say I've got 5 employees. Is that $14 per family?
Yes, sir. So it's $14. Think of it this way. It's $14 per employee, and whatever that employee's situation, and it covers them. So if it's
Okay.
2-year-old that just got out of college, $14 for him and everybody. The 43 that's got a wife and 2 kids, $14 for me, but I get to cover my whole family with it. And then maybe somebody that's, I don't know, maybe 55, has a wife, 2 kids that are in college, one's in North Carolina, one's in South Dakota, and then your parents are living with you, it's $14 for you, but you get to cover everybody. So it's $14 flat no matter what. It's just who's in your family and household for how far that extends to.
Okay. $14 head of household, and it covers everybody. Okay, cool.
Correct.
That helps a lot. Do you have a or is it on the web, all the things that are covered?
Yeah, I can send that to you. We have that flyer that's made out specifically for the plan for the EOC. Send that to you.
Okay, cool.
It says and more, so they don't limit it. So they list everything that's majority covered, and then they put and more because they don't want to be restricted to something that they can treat. They just haven't came across yet or something.
Understood.
Think of it this way. Think of the obvious thing that's going to be covered. Like my arm's bent this way. No virtual care is going to set your broken arm, right? You get in a car accident, virtual care is not going to do anything for you. You need to go to the emergency room and get things figured out. You had a bad accident at the company softball game and you cut your leg. You're going to need to go get stitches. You know, virtual care isn't going to be able to do anything for you there. So that's why it says it's at 70% of all doctor visits. It's 70% on average of doctor visits can be handled by the diagnosis, the prescription, and be done. It's those other 30% that need the treatment, the surgery, the whatever that obviously isn't going to be covered here. So it's just think of it in the common sense. It helps cover a whole array of things, not everything, but there's a whole bunch out there that can be taken care of real easy and an affordable price that this really handles conveniently.
Understood. Okay.
Well, and Joe, one of the other things that I think you've said, and you probably already said it today, was that when you do use the telehealth, as opposed to your insurance, it can help keep those costs down for you, especially if you're an employer that's providing that, right?
It's huge for the employee. And again, I don't want to go on forever, but it's huge for if you have health insurance, it's just as important. And if you don't have health insurance, it's obvious why it's not important, because you have nothing. And this gives you an opportunity for something and a full rate to see 70% thing. But if you do have health insurance, from an employer's perspective, every time you use the telehealth, you're not using the major medical. So instead of going to the doctor and paying the $180 or $200 for the earache, you're using it online to use it. From an employer's perspective, you're not driving up the claims on the employer's health plan. So when it comes time for renewal, less claim dollars means a better experience, which means better renewal rate. So it's helping the employer control costs for the health insurance from an employer's perspective. From an employee's perspective or an individual's perspective, it's huge for the reason I gave you earlier. Whether you're saving $25 or $50 on a copay, or you're like someone like me who has an HSA high deductible health plan, I'm saving a couple $100s because I'm paying everything out of pocket until I hit my large deductible. So when I go see a doctor, I don't pay a copay. I pay the entire charge. So I pay the doctor office visit, I pay whatever's going on back there because I have the high deductible plan. So I have to go through my deductible before I get coverage. This allows me to get covered for nothing, for my doctor, for my earaches, my sore throat, all that stuff. Now, if I don't have a high deductible plan, I have a traditional insurance plan. My deductibles, let's just say $1,000. Well, I still have a copay when I go to the doctor that I have to pay every time, right? You're never hardly ever leaving the doctor without paying something, unless you got a really bad year and you've hit your out-of-pocket maximum $70,000 or $7,200. Then God bless you, you don't deserve to pay anymore. But usually, every time you're going, you're paying something at the doctor. So from an employee's perspective, it's keeping dollars in your pocket, and from an employer's perspective, it's keeping company dollars in their pocket. So huge advantages for both, actually.
Right. Do we have any other questions? It does not look like it.
You guys have been awesome. Yeah, it came up with some really, really good questions. I appreciate this. This is a new topic. It's really blown up in the last couple of years. In the last 3 months, it's gotten even more big. And like Andrew said, I think you're going to see probably the whole industry change. I think you're going to see the medical field when it comes to insurance. I think you're going to see that change in the next 6 to 12 months. I'm not smart enough to know what those changes will be, but I've been in this long enough to know there are going to be changes. And I think you're going to see some huge incorporations in telemedicine. So you hear it on the news, keep your eyes out and see how it goes. But we're always here. We have a good plan. And if you guys have any questions individually, you can always call me, shoot me a text. I'm here to help you, whether it's about this insurance or any other insurance. I'll help you out the best I can. You guys are awesome. I appreciate your time.
Thank you so much, Joe. And I will allow myself to contact you via email because I am outside the US right now. I am in the middle of the Atlantic Ocean in the island,
wow.
in the Azores. Yes. So I left Florida around 3 weeks ago. So when everything was, I literally came back here with the last connection between island and US. And but I will shoot you an email because was everything very interesting and to me. But I have some more questions and I would like to talk to you. So I'm gonna just try to describe everything in my email.
Awesome. I appreciate that. And thank you for everything you're doing. Lon, thank you too. I appreciate it.
All right, guys, have a good one.
Thank you so much.
You too. Thank you. Thank you, Dorothy.
Thank you.
Have a great day.
And stay safe, everyone.
Thank you too. Thank you.
Bye-bye.